Good morning. Welcome to the program agenda. I'm your host, Cito Beltran, and you are watching us via Signal TV, channels 8 and 250 for high definition. You can also watch us via facebook.com/OneNewsPH, as well as on YouTube. Just enter One News PH, okay, or One News. Now, today is March 22, 2021. It's a Monday, and understandably, a lot of you are going to be waking up to a surprise. An expected surprise, I might say, because the rules technically have been re-implemented. There was all this talk about a lockdown, a major lockdown in the NCR, blah, blah, blah. And the government or the authorities said that's fake news. There will be no major lockdown. What we now have is a travel bubble. The people living in NCR, Cavite, Laguna, Rizal now belong to a travel bubble. You can travel within or inside that bubble, but you cannot go outside of that bubble for at least the next 2 weeks, if I understand correctly. I will read all of those information in a few minutes, and we will also be speaking with several guests today. We will be speaking with Dr. Oscar Tinio, of the spokesperson of the Philippine Medical Association, and Dr. Jaime Almora, president of the Philippine Hospital Association, regarding the status of hospitals, regarding the situation of health workers, etc. And after that, we will also be speaking with General Manager JOJO GARCIA of the MMDA, to find out what to expect in the next 2 weeks. Most of you already know there's a curfew. Most of you already know that there is, by now, I assume you now know that there is a travel bubble. There are several or many places in Metro Manila where certain streets or portions of barangays have been locked down, or whole barangays have been locked down, and that is to contain this rather unusual, disturbing surge. Sabi ko nga po, we are now on the second wave, third surge of COVID-19 in the Philippines. But before we go into the discussions, allow me to read the front page of the Philippine Star today. The government has placed Metro Manila and its 4 neighboring provinces, Bulacan, Cavite, Rizal, and Laguna, under general community quarantine and a travel bubble, which means going in and out of these areas would be restricted to essential travel only. This is to arrest the surge in COVID-19 cases, as Octa Research warns that if this trend continues, hospitals will be full by April. Senators, on the other hand, expressed alarm over an alleged proposal that would ban select firms in procuring vaccines for their workers. In particular, those who were allegedly, reportedly targeted were companies that sell alcohol and tobacco. Senator Franklin Drilon said such policy, if it indeed exists, is discriminatory and unacceptable. And in other news, Defense Secretary Delfin Lorenzana has called on China to recall its over 200 boats swarming the Julian Felipe Reef in the West Philippine Sea, saying that this is a violation of our maritime rights and sovereign territory. Okay, there you go. 200 fishing boats swarming the Julian Felipe Reef. If you want to get more details and you don't have a physical access to the Philippine Star kasi nasa malayo po kayong lugar, you can access Philippine Star on the web, on the internet, via internet, and mababasa kasi marami pong laman yung Philippine Star. So, welcome to the program, and in case you are having problems with your connectivity, please don't forget PLDT fiber internet. Minimum po kunin nyo na 100 Mbps. Huwag na kayong bumili ng mga pampatamang soft drinks, mga sugar, mga fattening. Kumaya kayo kay Kuya Cito, nag-jejeta na ulit. Okay? In any case, ayun na naman si in any case, let's go through the facts first before we bring in our guests. COVID-19 cases in the Philippines as of March 21, 2021. New cases, 7,757. Active, 73,072. Total cases registered, 663,794. New recoveries, 15,288. Total recoveries, 5,777, 5,077,754. Mga bilang ng mga bagong namatay, new deaths, 39. Medyo mataas po tayo dyan. And the total deaths is now, bilang ng mga namatay is fast approaching, and we'll probably hit that by today, 13,000. Okay, ito talagang si Charles Lejano, yung ating magaling na anchor sa news. Sabi, saka na tayo mag-steak, boss. O ano, natakot ka rin, ano? Ha? Biglang magkukulong ka rin sa bahay. In any case, a number of 7,999 new cases were recorded on March 20, the highest record in the country since the onset of the pandemic. Okay, ito na po. Health authorities also detected 114 new cases of the UK, South African, and Brazilian variants. Ha? Meron na rin daw pong Philippine variant. Okay, so hindi natin alam kung ilang kaso yung Philippine variant na yon, because the general idea is that the COVID-19 is the made in China. Made in China. I'm not being racist now. I'm just trying to, put it in perspective. It came from China. Now, it seems that it has evolved. Meron ng Philippine variant. Okay, here are the important things that you must know. Stricter GCQ in NCR and nearby provinces. Take note of the word stricter. Wala namang nagbago talaga eh. Except ngayon, ginagawa na ng gobyerno yung dapat matagal na nilang ginagawa o pinapatupad. Well, we can't fault them for trying to give us normal lives and trying to recover the economy because it's really shot. Anyway, government imposes stricter GCQ in Metro Manila, Bulacan, Cavite, Laguna, Rizal, starting today until April 4, 2021. Napaka-significant. Puro sakpo niyan sa akin. Birthday ng tatay ko yan, si Cito Beltran. Okay. Only essential travel is allowed in and out of Metro Manila, except for essential workers who will need to show their work ID, and health and emergency frontline services personnel, pwedeng bumiyahe, government officials and government frontline personnel, biyahe ang mga yan, lalo na yung mga kumakampanya at kakandidato, nag-aambisyong maging senador. Duly authorized humanitarian assistance actors. Hindi naman siguro dapat actors, no? Pero anyway, that's how they term it. Persons traveling for medical or humanitarian reasons, persons going to the airport for travel abroad. I received a text message very early this morning asking me if we will tackle this travel thing today. And I said yes, and they said, could you please get clarification regarding travel? Well, Alan, my dear friend Alan, nothing has really changed. You can bring your family or whoever to the airport and then go back home. Kasi tigali pa po itong si Alan. Dadalhin niya yung kanyang, ewan ko kung misis niya o kapatid niya o kung ano man, dadalhin niya sa airport. Pagbalik, kailangan you need to have a photocopy of the travel document, particularly yung schedule. So because it will show there that today you had your relative flew out from NAIA or wherever. So yun po, no? Okay lang, Gab, sandali, I'm just setting it up. Okay, now, what did I say? Okay, travel abroad, anyone crossing zones for work or business or going back home. So katulad ko, nandidini kami sa Lipa, pero kung kinakailangan ko umuwi sa Manila, pwede akong umuwi. Kanya lang, yun po yung mga with persons authorized outside of residence and returning overseas Filipinos and OFWs. Persons below 18, above 65, those with immunodeficiency, comorbidity, or health risk, and pregnant women are not allowed to go out of their homes except for obtaining essential goods, services, or to report to work. Seniors above 65 years old allowed to engage in outdoor non-contact sports, check other forms of outdoor exercises. Tanong siya, papayagan ba sila magsumba? Di ba? Doon sa San Juan, doon sa pinaglabanan, sabi nila, Vice Mayor, wala na, tigil nyo yan at baka dyan pa magsimula ang problema. Okay, and konti na lang to. Holy Week out of town plans in NCR, Bulacan, Cavite, Rizal, not allowed, checkpoints to be reinforced. So magkakamustahan na naman kayo ng mga pamilyar na mga muka. Bigyan nyo naman po ng soft drinks, tubig o sandwich yung mga kapulisan natin na nagmaman yung mga checkpoint. Para feeling good din sila, feeling loved din sila, and loving naman sila sana sa ating mga mamamayan. Hindi yung nakalabas ba yung Armalite? Kainis talaga. General Sinas, pwede ba? Maninita lang ng mga naglalakad sa kalsada, nakaganon pa. Yung mga mahaba ay sos, Ginoo. Okay, all mass, public gatherings, religious events are prohibited, weddings, baptisms, funeral services allowed, but only to 10 attendees. Okay, public transportation to retain current capacity, commuters reminded to adhere to health protocols. Outdoor dining will be allowed but up to 50% capacity only. No driving schools, traditional cinemas, video interactive games, libraries. Pati na po sa mga kapatid nating nagsasabong. Sorry, kasi kayo naman, alam naman ninyo yan, dikit-dikit kayo, sigawan pa kayo ng sigawan pag nananalo yung mga dehado. So, ayun po, I'm just clearly reiterating, because it's true. There is no lockdown. They are merely reinforcing what they should have been doing. And so we're back to square one. So let's bring in our guest for today's interview. First interview, Dr. Oscar Tinio, spokesperson of the Philippine Medical Association, and Dr. Jaime Almora, President, Philippine Hospital Association. Doctors, good morning to both of you, sirs.
Good morning, Cito. Good morning, Jim.
Okay, well,
good morning, Cito.
Okay, allow me to start with Dr. Tinio because ngayon ko pa lang yata makakausap itong si Dr. Tinio. First time with us, Doctor?
Yes. And I'm a fan of yours. I mean, I always read your articles start.
Wag niya po sasabihin yung fan na yan. At baka batukan ako ng misis ko dito. Anong fan pinagsasabi mo? Anyway, guys, it's a free-for-all, but I'll just start with Dr. Tinio. Welcome to the program agenda. Now, what is the situation among health workers, and what is the sense, or how does the PMA view what's happening? Ano bang nangyayari? And ano ang pwedeng gawin ng mga mamamayan? Dr. Tinio,
Yeah, mahabang sagutin yung mga tinanong mo.
go
Actually,
ahead.
we are alarmed about things that's been happening right now, particularly sa yung surging COVID cases in the country. Because first of all, sino ba yung mga humaharap dun sa mga pasyente? Hindi yung mga doktor. And the Philippine Medical Association is the association of all physicians in the country. And we have been getting reports from various places na nagkakaroon po ng pagkahawa na naman uli yung ating mga manggagamot. We're really having some concerns right now because some of our doctors are in critical conditions. But overall, we are alarmed, we're scared. We don't like what is happening right now. Our hospitals are getting filled up. Our doctors are getting scared again. Alam niyo yung problema, pagka yung doktor umayaw tumingin sa mga pasyente, we will have problems talaga. And we will be overloading our government hospitals. Alam niyo, yung usually, pagka yung government hospital, talagang required yung ating mga doktor doon na forcibly harapin yung mga pasyente. And this is very scary because of the fact na nahahawa pa rin whatever precautions that we do. And of course, ang masakit sa loob namin pagka may mga kaso kami na narinig ng mga manggagamot na nasa ICU o in critical condition or in serious condition. And it's really something that I think we need to do something about. Ang tingin kasi namin dito is bakit may surge? I think it's multifactorial. One is, well, yung presence ng mga ng supposed to be ang sinisisi ngayon is yung bagong variants. But no matter what, the virus, no matter what you do, it's going to have variants. It will have variants, no? Talagang ganun talaga yung nature ng virus. It will mutate, it will change its structure to fight off whatever defenses that we may have built against it. Government is trying to parang to ease up the restrictions. So ngayon, ang dami ngayong mga tao na lumalabas na talaga, ang dami ngayong mga tao na gustong bumalik uli sa normal na buhay. They're so tired of getting restricted. So ano nangyayari is, lalabas talaga. And the sad part about this is, nakakalimutan ng marami sa atin yung sundin yung basic health protocols. I can see a lot of people outside of their homes na walang maskara, or if they wear shields, yung face shield nila nakataas. Pagkatapos, sa mga public conveyances natin, sa mga jeeps, hindi ko maintindihan kung bakit ngayon, punong-puno na yung mga jeeps. Tapos meron lang barrier do sa gilid na plastic. What can the plastic do? Nothing. In fact, pwede pang tirahan ng virus yun at pag tumama sa mukha mo yun, lalo ka nang maaaraw doon. Ang mga buses natin are full. There were several times na pag ako'y nagmamaneho, tinitingnan ko yung mga buses and I see even yung mga conductor, hindi nakamask, yung mask nasa baba. And I think one of the major sources of spread yung public conveyances, yung mga jeeps. Pumunta ka ng palengke. Sa palengke, people are just swarming all over the place. Talagang matindi. And sad to say, but we have squatter areas, we have highly congested areas na yung mga tao talaga, they don't really care. Ginagawa pa nga nilang parang sala nila yung kalsada. They're all outside of their houses, mingling with each other, talking to each other without any protection at all. And what is ito yung at sa tingin ko, ito yung major source of look at that, major sources of the spread or the surge of infection. And you're right, dapat noon pa natin ginagawa ito, kung ang gobyerno noon pa ginagawa ito, the same kind of restrictions, siguro hindi tayo aabot sa ganito. At hindi nakakatakot na mapuno yung mga ospital natin. Alam ni Dr. Jaime yan. Ako yung ospital na minamanage ko. We're full to capacity, no? Talagang mabigla ka talaga maggulat sa atin. Ang dami nakapila. May mga waitlisted kami mga pasyente na waiting for admission. And I think that's also happening in the other hospitals. And I can just imagine kung ilan dyan ang mawawala o who will succumb to death. Talagang it's really, really, really very alarming. It's
Okay.
scary. And I think we should all be concerned.
Okay, Dr. Jim, Jim Almora, what is the situation in the hospitals? Kasi nadidinig lang ng tao, nearing capacity. It's already the 22nd today. Ang sabi sa akin ng mga kaibigan natin sa Octa Research Group, sabi, Cito, April 1, sapul na lahat yan, punong-puno na lahat yan. What is the real situation?
Yes, Cito, good morning. Nice to meet you again. Ang ganda ng background mo, very refreshing.
Sorry,
Yes,
nagtatago na ako, tumakas na ako.
Maganda yung taguan mo, talagang fresh air. Okay, yung mga hospitals, tama sabi ni Dr. Tinio, sa NCR, sa over 60% na tayo. Mal-distributed, nandiyan ang maraming cases. Sa probinsya naman, nationwide as a whole, nasa below 50 pa rin tayo. Nasa mga 39 yata yesterday. So, ang capacity, we always talk of capacity, but the capacity is relative to the capability. Ang problem, ang normally, sa mga hospital, pag nagkakaroon ng mga surge ng mga infection, nag-i-expand ang capability ng hospital. Dinadagdagan lang yung kama. So yung capacity nila, dinadagdagan lang. But in our situation now, yung capability ng hospital to provide the nursing service, to man those beds, is not really there anymore. Even before nagsimula ang pandemic, kumukunti na mga nurses, pumupunta na sa mga mas mataas ang sweldo, especially sa uniform services, pumupunta sa abroad. Then, nung nagkaroon ng pandemic, maraming nag-resign, binawalan ng mga pamilya para mag-report sa trabaho. So, sumunod doon, nag-hire ang DOH sa napakaraming mga nurses, magmaman sa mga case tracing efforts nila. Nanggagaling sa private hospital lahat yan. So, talagang na-decimate yung capability ng mga hospitals, especially private hospitals, to provide the nursing power. So yung natural na tendency ng hospital, which is to expand the facility, nawala. Yun po yung real issue po ngayon.
So you can have all the beds you want in the Philippines, but if there are no doctors or not enough doctors, not enough nurses, it's all pointless. Kasi we always keep hearing about beds, pero kung wala namang mga nurses o kulang at etc. What exactly? Dr. Oscar, you mentioned dapat, you agree that we as one nation should have really implemented or followed the strict guidelines of GCQ. So we agree with that. Now, medically speaking, Dr. Jim, Dr. Oscar, what are we doing wrong? Kasi may mga lumalabas ngayon na medyo nakikipagbanggaan na sa authorities yung grupo ng nagpupush nitong ivermectin, nitong hydrochloroquine ba yun or something, hydroxychloroquine. And so parang prophylaxis or advanced protection for COVID-19. Some people are saying na dapat unahin yung mga symptomatic lang, hindi yung mga critical na hihintayin mo pa yung maging critical. Guys, what are we doing right or wrong?
Well, I think as far as doctors are concerned, we have always pushed for maximum compliance with basic health protocols. Wearing of face masks, wearing of face shields, social distancing, frequent washing of hands, not congregating. So these are basically, kung masusunod natin yan, the spread of the virus should be contained. Alam niyo yung problema ng virus kasi is, it needs a host para siya mag-survive. And the host should be individuals, tayo. Kung wala siyang nilipatan, within 14 days, it disappears. So, nagbibiro nga ako nung nakaraan sa mga kausap ko. Sabi ko, there's a solution. I-lockdown mo ang buong NCR, walang lalabas sa bahay for 15 days to 30 days. Ubus lahat yung virus na yan. But that cannot be possible because we have to maintain our livelihood, and at the same time, as for us doctors, we have to make people live. Ibig sabihin, ayusin namin yung dapat yung mga doktor ay nakahandang humarap sa ganitong klase ng mga problema. Tapos may mga lumalabas na mga usap-usapan na time out. Sabi ko, ano bang time out? The doctors should never go on a time out. We should be more adept and we should be more competent in handling these cases. No, dahil isang taon na natin yung kaso eh. In fact, we have reduced mortality right now because we are able to manage cases right now. Yung mga ivermectin na yan, these are, alam nyo, I think, nabalitaan ko nga, mayroong doktor sa atin na nagbebenta ng ivermectin. Alam niyo ba kung ano yung ivermectin? It's an anti-parasitic drug. Kung kayo ay may aso, kung ikaw may alagang mga puppies, pagka nagbigay ka ng heart guard, yun yung ivermectin. So it kills worms sa katawan ng ating pong mga alaga, ng ating mga aso, particularly kaya nga heart guard yan, panglabang pamatay ng heartworms. So yun yung pinupush ngayon ng ibang mga grupo na pwede daw gamitin yung ivermectin. Hydrochloroquine, I think we have tried that before, and according to scientific researches, it doesn't do anything. Walang masyadong naitutulong. In fact, we're not using that any longer. So there are
Okay, but is there, Dr. Oscar, pasensya ka na, I have to be fair, no? I have to carry the ball for those who are not present, so to speak. Now, I mean, this is going to be funny, Dr. Jim, no? Pero it's factual, no? Yung Viagra was not intended as a medicine for penile dysfunction, di ba? Hindi yan pampatigas. Di ba? Erectile dysfunction. Sorry, hindi ko na alam. Okay. Yung Viagra was originally for, hindi ba, for blood circulation, etc. Ano ba yung
actually designed for hypertension and partly for ulcers.
Okay. So, yun lang yung ibig sabihin, no? Hindi ba nangyari yan in the past that you have medicines that were intended for something? Katulad yung Coca-Cola. Originally, ang Coke na yan was medicinal, supposed to be. Ngayon, naging soft drinks. Ngayon, nagpapataba pa sa atin, ano? So, presenting that argument, what's your response?
Actually, katulad yung sinabi mo kasi sa Viagra. Ang ginawa sa Viagra, o sa sildenafil for that matter, yun yung generic name yan eh. Inaral mabuti. So, several clinical trials, yung lahat ng klase ng mga clinical trials ginawa. It was proven na it can do this particular kind of action na it can correct erectile dysfunction. So, instead of marketing it for other purposes, ang ginawa ng Pfizer is we will market this as an erectile dysfunction drug. Yung safety naman niya, napag-aralan naman, and there have been precautions on how to not to give it to persons na merong specific katulad din ng specific group of people na groups of people na hindi mo pwedeng bigyan ng sildenafil. Katulad din ng bakuna, yung bakuna natin ngayon, yung sa Astra, saka yung sa Moderna. So, binigay siya ng marami, no? So, napag-aralan, okay, it's alright. Pagdating ng phase 4, yung ginagamit na talaga sa population yan, nakita nila na pagka meron kang hypersensitivity reaction, if you have severe hypersensitivity reaction, you can react to the drug, to the vaccine. So ngayon, bawal na ngayon bigyan yung may mga known hypersensitivity or severe hypersensitivity.
But aren't we doing the same thing, Doc Jim, Doc Oscar? We're doing the same thing with the vaccines. We are using medicines or vaccines that have not officially been approved. We are using it for emergency use, authorization, and compassionate use. So anyway, ayoko makipag-argue sa'yo, pero parang I'm just bringing that there kung ano yung sentiment ng PMA at saka ng Hospital Association.
Just let me kung magkakaroon tayo kasi ng studies on ivermectin, ay hydrochloroquine kasi napag-aralan na, ivermectin, why not? It can be a potential drug that can be, pero wala pa kasi studies. We're still waiting for studies. So if there are scientific studies proving that ivermectin can be used, by all means, gagamitin natin. Yun
Oh,
lang.
kasi lumalabas sa Doc Jim sa mga alleged presentations, no, allegations, very effective daw as a prophylaxis or preventing severe cases of COVID, and meron pang binanggit na bansa, Paraguay yata, yung kanilang presidente tinamaan ng COVID, ginamitan siya ng ivermectin, gumaling siya, sabi niya lahat bigyan. At mas murang maggamot ng ganyan. In any case, okay, Doc
Yan
Jim,
naman, ganyan naman
uh,
nagsimula.
go
Lahat
ahead,
ng
Doc
gamot,
Jim.
ganyan ng gamot, lahat ng gamot, ganyan nagsimula. Medical science is in a process of evolution like any other activities that we do. So it's an evolving process. And time will tell, studies will tell kung tama o mali. Meantime, because we are forced to use it, compassionate or experimental, yan ho, maraming claims na lumalabas. Pero ultimately, lalabas din kung tama o hindi.
It's only a
Okay.
matter of time.
Yeah, a matter of time. Kumbaga, no, in the long of time, sabi nga nila. No? In any case, let's go for a quick break. And when we return, tanungin ko naman kayo, what is your assessment of this new setup, and what would your prognosis be for your hospitals, your physicians? Kasi like with you, Dr. Oscar, medyo na-shock ako na meron palang mga ilang doktor na critical or nasa ICU. Medyo hindi lumalabas yung balitang yon. We'll go for a quick break. We'll be right back here on Agenda. Okay, you're back here on Agenda. I'm your host, Cito Beltran, and with us are Doctors Oscar Tinio and Dr. Jim Almora. Jaime Almora. Dr. Tinio is the spokesperson of the Philippine Medical Association, while Jim Almora is the president of the Hospital Association. Okay, new setup, old rules. Parang ang hirap. Hindi ko ma-figure out ito. Anyway, so the government is now clamping down, is enforcing curfew, travel bubbles, etc. What is your assessment? Is this the solution, or is there something we are overlooking or forgetting? Dr. Jim.
Yung bago ngayon, yung travel bubble ba yan, Sito?
Yeah.
Definitely sa health sector, advantageous yan. Pero alam naman natin na more complex than that yung issue. Yung mga tao, sabi nila, hindi na mali mamatay o mamatay sa COVID, gusto wag lang mamatay sa gutom. So, complex yung issue. Pero sa amin sa health sector, definitely makakabuti sa amin, makakabuti sa health ng ating mamamayan.
Okay, now what about yung sinasabi mong problema sa manpower? Kasi may kama nga, wala namang nurse, wala namang doktor. How serious is the situation, and what are the solutions?
Very very serious and very complex yung solutions ito. Alam naman natin na yung main reason kaya nawawalan kami ng nurses ay yung salary na may bibigay ng mga hospital, especially private hospital. But alam naman natin na the price of services or goods is determined by the ability or the capability of the customer to pay. So, unfortunately, tayo dito sa Pilipinas, ang income natin ay income ng Pilipino. So ang binabayaran natin ay yung presyo ng services and goods ng Pilipino. Remember that in the hospitals, all, and I mean all, the things that you see in the hospitals are all imported except the manpower. Imported ang bulak, imported ang gamot, imported ang equipments, supplies, dollar denominated lahat yan. And because they are dollar denominated, yung mga nag-earn ng dollar, yun ang nakaka-afford. Yung mga higher ang per capita income na countries, yung mga people with higher income, nakaka-afford. Unfortunately, taas din sa Pilipinas, the majority of our people belongs to the CND, socioeconomic class. So talagang hanggang doon lang, hanggang peso lang yung kaya nilang bayaran, hindi nila kaya yung dolyar. So ang naipit dito ay yung labor cost dahil nga yun lang ang hindi imported. Pero sa mga higher hospitals, yung mga pinupuntahan ng mga class A or B, ayun ang pwedeng magbigay ng mas mataas sana dahil nga yung capability naman ng mga customer doon ay higher. Pero marami din naman kasi silang pasyente galing din sa lower economic class, kaso lang nandun yung equipment, nandun yung facilities, nandun yung mga specialist, kaya doon sila pumupunta. Kaya ho, nahihirapan din yung iba pumupunta sa malalaking hospital. Pero as a whole, yan po yung situation, manpower ang problema. Naintindihan naman natin kung pumupunta sila sa abroad dahil of course there is a better, greener pasture there. Ang nangyari dito sa ating bansa, nagkaroon ng maldistribution ng nurses dahil sa inequitable salary distribution. Ang gobyerno nag-offer ng pakataas na sweldo sa mga military services. As a result, mga nurses from the private hospital, lumipat sila. Ang dami. Ang PNP may 9,000 nurses. Sa military, marami rin. Sa Bureau of Fire Protection, yung mga non-health related, pinuntahan ng mga nurses dahil mas marami ang sweldo doon. Understandable naman yan dahil siyempre kailangan din nila, karapatan nila. Pero it's not also good to say na yung mga hospital hindi nagbibigay ng tamang sweldo. Binibigay lang naman po nila yung hindi po yung private hospital nagpapasweldo, nagpapasweldo yung pasyente. Pag tinaas ng hospital yung sweldo, tataas din nila yung cost of services, especially sa manpower. And remember, hindi naman binapayagan din ng PhilHealth na ilagay mo doon yung nursing service fee. Wala yon. Kasama lang sa accommodation fee yung nursing service fee. Yun yung dapat namin gawin. Ilagay namin yung nursing service fee para maibigay namin na mas mataas. But then again, majority of our people belong to the CND. Hindi nila kaya talaga yung sweldo na bino-offer. Kung i-compare mo abroad, mas mataas talaga yung offer doon. It's not right to compare.
Are you saying that the PhilHealth menu of payments, di ba? Kasi lahat ng yung may mga case rates yung mga case rates ba is not sufficient to sustain private hospitals?
Exactly po. Especially ito kasi yung mga COVID cases, maraming issue po yan. Ang number one issue yan, hindi pa binabayaran ng PhilHealth yung mga COVID cases. Sa karamihan ng mga ospital o lahat naman ng ospital na nakausap ko kasi, yun ang sinasabi, hindi pa sila binabayaran ng PhilHealth. And of course, alam din naman natin na may problema nga ang PhilHealth. Madami silang problema and iba yung attention nila ngayon kasi sinusolve nila yung internal problem nila ngayon. So parang sa tingin namin kami napapabayaan na dahil iba yung sinusolve nilang problema, yung sa internal problem nila. Pero ayun nga, isang issue is yung PhilHealth benefit package para sa mild and moderate, masyadong mababa. And these are supposed to be the ones to be admitted in the lower level hospital, yung level 1. Pag yung mild 43,000, kwan lang yan, dalawang araw lang on the average, ubos na yan kasi sa rough estimate ko, maabot ng mga 28,000 to 30,000 per day ang dapat gastusin sa mga mild cases.
Well, that's very clear. That's very clear, Doc Jim. No? Ngayon, tanungin ko lang, Dr. Oscar, as far as yung sinabi mo kanina na dapat mag-total lockdown na lang, etc. No, but you know, I can't figure that out because that was what the government, Duque, World Health was saying in the first trimester of COVID-19. Sabi nila, if we lock down and we don't move around, 14 days is more than enough. Una nga, 7 naging 14. To obliterate the virus. But why can't we do this in sections? Is this medically correct, Dr. Oscar?
Well, yung kasing at that time nung itong mga ating mga health protocol measures na yan, these are protocols because we didn't have any other alternatives then.
Mhm.
Ibig ko sabihin dito is that those were the best things na pwede nating gawin under the circumstances. So even now, ganun pa rin dapat. Ngayon, is government doing it right? Right now, I think that was yung tanong mo kanina. Finally, I hope we strictly implement the protocols. Government should be able to manage to be able to implement whatever it's saying. Kasi hindi naman talaga na-implement. Pero hindi tama yung ang mag-check sa atin, yung mga naka-arma light at mga ano. Because hindi natin kailangan actually yung militar na gumawa niyan eh. We have our local health units, local health authorities to do this, although nahihirapan na sila. Now,
Actually, in fairness to the military, Dr. Oscar, hindi po militar, police na nagpapanggap na
police
militar.
pala. Yeah, the police. But tumutulong na rin ang militar during the lockdown. Ano? Ngayon, ang solusyon kasi ngayon na nakikita namin sa PMA, we do all the protocols, but we have to hasten the arrival and the availability of vaccines because yun pa rin ang primal solution na kailangan mabakunahan natin lahat ng ating mga mamamayan.
Yeah, okay, wait.
We missed out on that.
Okay, doctors, I need to ask this last question because it seems that whole deal, yung tripartite na yan, has essentially gone crazy. The private sector, the Chamber of Commerce, they're all pounding their fists on the door. Pabilin nyo kami ng sarili naming vaccines. Allow us to buy. The government is saying that cannot be because the pharmaceuticals demand that there be a protection clause for this EUA, etc. And tapos ang nasisisi ngayon yung mga pharmaceuticals. So, what quickly are your suggestions regarding this mess? It's a mess. Nothing. You can't call it anything else.
Yes, if I may answer first.
Yeah.
Everybody is doing their best, but they are looking at things from different perspectives. Of course, yung mga businessman, ang nasa isip nila is how to bring back the economy right away. Yung mga politicians, they come from different perspective also, and the health sector from another perspective. So iba-iba talaga yung gusto. Yung mga nasa FDA, ang concern din naman nila maibigay yung tama kasi baka mamaya mangyari pa yung dingbaksya hulabalo na naman ulit. So without an FDA license, without the phase 4 trial, hindi talaga pwedeng i-release commercially. Kasi pag binigay mo sa private sector yan, parang binigay mo na as a commercial item. Hindi naman pwedeng commercial item pa yan. Emergency use authorization lang. So everybody is coming from their own perspective. Some are looking it on their way na
but how do we solve it?
Yes, it's a complex issue. Mahirap talaga. There are laws to follow, there are rules. Yung mga nagpapatupad kailangan sundin nila. Yung expediency isang issue, ang utility kailangan emergency use nandiyan na. So everybody's right in their own perspective. It's a complex matter.
Yeah. Okay.
I see bilisan lang ng gobyerno dapat ang ginagawa nila at lahat makipag-participate.
Okay.
Kung aywan ko kung bakit hindi makapag-agree pero willing nga ang marami sa private sector.
Okay. Doc Oscar, I give you the last word. Do you think we'll actually have all those vaccines or should government simply say, okay, sige, order taker na kami, amin na yung order nyo, tara, game na tayo?
That's it. Actually, that's the solution. Government should put their acts together. It should impose itself. Dapat, total naman, emergency use authorization lang yung mga bakuna. Hindi talaga po pwede sa for commercial. So let government do its work. Dapat sila na yung mag-ayos. Sila makipag-usap sa lahat, hindi yung kung ano-ano mga lumalabas dito na si ganito bibili, si ganito ganyan. Bigay na lahat ng pera, bigay na lahat ng kaya nating maibibigay para mabili yung bakuna. And that is the final solution to stopping COVID-19 anywhere and in our country particularly.
Okay. Well, thank you very much, Dr. Oscar Tinio, Dr. Jaime Almora, for your time today. Medyo maiksi po ang oras, pero marami naman tayong nasagot. And we pray sincerely that the hospitals don't fill up, na kahit papano itong circuit breaker ay makatulong. We pray that the doctors and the frontliners are able to protect themselves by God's grace, and that you all do well. Thank you very much for your time, gentlemen.
Maraming
Thank you,
salamat.
Cito.
Thank you so much. Thank you so much.
Okay, yan po mga kaibigan ang ating first part. No? Now, here's the deal. Kasi I call it a mess because I remember Secretary Carlito Galvez saying, you know, the procurement process of government is so convoluted, so legalistic, that it's not easy for us to simply buy. And then the FDA said, kung wala yung emergency use authorization, hindi rin pwedeng gamitin ng private sector. It is not for commercial purpose, etc., etc. But Charlie Galvez pointed out that private sector and the government and the pharmaceutical companies can all work together to make this possible. Kasi sabi nga ni Charlie Galvez back then, we don't have all the money to buy all the necessary vaccines. Although nangutang na yung gobyerno, okay? Now, the problem is, now, 1 year or 8 months later, sabihin na natin, or 6 months later, you have another spokesperson for the National Task Force saying, actually, hindi naman kailangan mag-donate. Hindi naman namin pinipilit mag-donate yung private sector ng vaccines, etc., etc. You know, it's like, guys, let's just stop pointing fingers or making excuses. Or let's just stop, okay? Let's just be nice to each other, sit down, and have one common goal. Guys, paano ba natin gagawin to? Paano ba natin mapapasok lahat itong mga vaccines na ito in the quickest possible time so we can roll out the vaccines? And in the meantime, I am calling out to all our fellow Filipinos, please, tabi na muna natin yung ating right to criticize, right to comment, and let us try to just abide by this new travel bubble for those of you in NCR, Rizal, Cavite, Laguna, and Bulacan. Medyo stay muna kayo and try to stay safe. And hopefully, one thing that no one in government or even in the religious seems to have done so far, yung bang unified call for prayers. Magdasal po tayo bilang isang bansa. Hindi po yung mga puro na tayo, orasyo, ewan ko ba kung ano yung tawag doon. Pero sa TV, sa radyo mo lang madinig, hindi yung taong bayan. Let us as a nation and the Filipino people pray to God for intervention and healing. Okay, speaking of intervention, intervention na si the General Manager JOJO Garcia of the MMDA, isa pang taong palagay ko sleepless in Metro Manila. GM JOJO, nice to see you again. Looking good.
Hi, good morning. Good morning, Sir Cito. Good morning to all your viewers and listeners po.
Okay, what can our citizens in the NCR, Cavite, Laguna, Bulacan, Rizal expect with this new travel bubble? And ano ba ang situation natin ngayon? Because we are all calling for people to stay home and to stay safe. So, could you give us an update, GM?
Yeah, actually last Saturday we had an emergency meeting ng IATF, no. It took us until 1 a.m., no, just para ma-plancha lang lahat yan. And then yesterday we had a meeting with the mayors, no, early morning, mga 9 a.m. It took us 3 hours again, to discuss yung mga precautions, I think ito pong ginawang bubble, no. We call it the bubble, no. It's not only about NCR. I think this is the right thing to do. Why, no? Sabi nga natin, ilang beses namin sinasabi ng mga mayors, mag-higpit tayo sa Metro Manila, mag-higpit tayo sa ganyan, ano? But let's say you're from Taguig or Makati, you just ride your car or your motorcycle, you go to Tagaytay, you go to Rizal, you go to Bulacan, no? Pagdating doon, medyo MGCQ sila, maluwag, you can dine in, no? You can remove your mask, pwedeng uminom. And then pag-uwi rito, mahigpit na naman, no? May physical distancing, etc. So, baliwala yung purpose, no? Kasi nga, halos borderless na. That's why, di ba, sa NCR, lagi namin sinasabi, one voice tayo because of the borders, no? Tawid ka lang. Just the same to Cavite, Bulacan, Rizal, and Laguna. So, when you, pag ginamong bubble yan, no? Meaning, we can contain it inside the bubble. Hindi na kasi mga new variants. No? That's why you can only go out of the bubble if it's essential. Meaning if you go to Pampanga, Batangas, kailangan essential lang. Hindi na pwedeng turismo muna or leisure yan para pumunta ka dyan. Yeah, but within this bubble, I think may regulation na tayo. For example, yung dine-in and a closed space, no? Indoor, pinagbawalan muna natin yan. Kasi nga, sabi ng mga expert, talagang dito yung transmission napakataas, no? Kaya nga, pati yung mga last night, I think we started at 9:30 p.m., ganun kalit, no? Kinausap namin ng Rizal Province with Governor Nini Iñaras and all the mayors of Rizal to brief them what guidelines, no? Kasi nga kasama na sila, kaya pati sa mga guidelines, we need to tell them what to do if they have any questions.
Yeah.
Now, may mga nagtatanong, lalo na sa mga probinsya nga, paano pwedeng positive, kulang quarantine space, no? Baka pwede sa bahay na lang. Kasi nga may mga experiences tayo. Ako, dati, nagka-COVID tayo, sa bahay lang po, wala namang nahawa, no? But sabi nga natin, iba yung variant ngayon eh. We don't know. Before, if you're 10 inside your house, no? May magka-COVID yan, siguro 1, 2, malas na kung 3 na hawa sa'yo. But right now, because of the new variant, no, kahit anong pag-iingat mo, kung 10 kayo meron.
GM Jojo, pasensya ka na. Kasi I have been telling people about this new variant. And I've been telling people, mag-iingat kayo kasi matindi pa ito sa tipaklong kung tumalon. Mahahawa kayong lahat. But unfortunately, Secretary Duque and some other people started saying, hindi naman yung new variant ang dahilan ng pagtaas, paghawa, etc. So parang sabi ko, ano ba? Tumutulong na kami, nakakagulo pa tayo.
No, actually, Sir Cito, when they presented to us, they say it's not only the new variant. There's lots of factors. No? It's not, what's that? No? Number 1, yung minimum health protocol. Yung pagsusot ng tamang face mask. Yan talaga ang cause. No? Sabi nga ng health department natin, once you wear your face mask, facial and physical distance, 97% hindi ka mahawa. Definitely.
Correct.
That's the best vaccine, no? Yung minimum health standard. Now, if you cannot, hindi mo talaga maiwasan, no? Talagang i-limit natin yung movement. Ano ba yan? Let's say sa workplace, there's a canteen, wala mo nang kakain sabay-sabay, no? Kasi that's the time you remove your mask, no? Yung mga smoking area, yan, medyo higpitan natin yan. Kasi nga, yan yung time na nagre-remove ko ng mask. Kadalasan ng transmission nangyayari sa pag-remove ng mask, eh. So, ito yung mga bagay na kailangan nating iwasan. So, isang factor yan, no? Ang second factor siguro, yung new variant, mas transmissible siya. So, madaming factors yan eh.
Yeah.
That's why nga, pagdating sa household, bakit natin sinasabi i-quarantine natin yan, tanggalin. Alam naman natin, pagdating sa bahay, wala nang minimum health protocol. Kasi sanay kayo, kakain kayo together, you will talk
Kakasama eh.
other, magkakasama kayo.
Yeah. GM, tanong ko lang, no, kasi you know me personally, hindi ko kayo kinokontra, suportado ko ang gobyerno, no. Pero may mga tanong na kailangan ko itanong as a journalist, no. Now, here's the question. Nag-travel bubble tayo. Naghihigpit tayo sa mga checkpoints, etc. In other words, there's really nothing new kasi GCQ yan eh. And we've always been GCQ. We tried. In fairness to the government, we tried to relax it a little para yung economy natin gumalaw, mga tao makalabas, makapaghanap buhay, etc. Unfortunately, the experiment or the attempt has failed. So, higpit ulit. But what happens if the numbers don't go down? Kasi ito yung sinasabi sa akin eh. May bubble ka nga, Sito. Pero kung sa loob naman, lahat naghahawahan pa rin, paano na? Paano na ang gagawin natin?
Yeah, definitely, no? Sabi ko nga. Kaya nga doon sa bubble, mas maliit siya compared to the whole Luzon or to the whole Philippines. No?
Mm.
Okay. Bakit natin meaning, malaki siya per se. Pero compared to whole Luzon, maliit siya, mga pwedeng i-control. Mas kaya i-control ng ating mga LGUs. That's why we gave guidelines what to do, no? Para iwasan yan. So, mass gathering definitely hindi pwede kasi may transmission. No? Actually, pinayagan lang mass gathering, yung tinatawag na KBL, kasal, binyag, libing. Pero maximum of 10. So, meaning, kasi ang mga tao minsan, tuloy-tuloy lang yung ginagawa nila. Nakatulad ng sinabi niyo po, no? January, February, tuloy-tuloy lang. Nagkakaroon ng COVID fatigue, nagiging sanay na, normal, complacent na. Kaya pag bigla mong boom, ayan, maghigpit tayo nga, at least kahit pa paano, mawawarn natin sila na sandali. Hindi porket dumating ang bakuna, kailangan na natin ma-relax. Tuloy-tuloy lang. And then talking about the vaccines na I heard kanina.
Oo.
Siyempre, ang daming mga chismis na it will take us 30 years, the way that we do it, di ba? Okay, I can assure everyone.
Hindi chismis yun na GM. Isa na ako doon sa nag-compute kasi. Kinompute namin sa rate of vaccination. Sabi ko, tinamaan lang ewan pag ganito tayo at kukonti at ganito kabagal. Pero nasagot naman yun. Nasagot yun nung ina-interview ko na sinabi Sito, the hospitals and the frontline workers, hindi namin binibigla kasi pag binigla namin at puro yan may mga side effects o medyo may nilalagnat o masakit ng katawan, baka wala nang magtao sa mga hospital. So, thank you. Kasi,
just to assure you, everyone, in NCR, I can speak, on behalf of the NCR. Nagtanong tayo sa mga mayors natin, ilan ba yung kaya nilang bakunahan? Okay, kaya bakunahan ng 17 LGUs sa NCR is around 120,000 a day. 120,000. When you're talking about 14 million population in NCR, 70% is herd immunity, so that's around 10 million. Sabi ko, in 4 to 6 months, we can finish it. Basta may bakuna. We can finish it, including the second dose.
Panalo pala yung Mat 11 Go. Kasi sabi ko November Malamang November yan.
Yeah, that's why before, hopefully our Christmas will be really fun and happy.
Pero GM, what happened to that plan? Kasi hindi ba noon tuwan-tuwa ako nung sinabi ng mga Metro Manila mayors, bibili na kami ng sarili naming vaccine.
Okay,
what happened?
According to Secretary Galvez, kasi nga, yung order ng mga LGUs natin, we're expecting by June or July. Hopefully, Alam mo naman po natin yung demand, international, Talagang, napakaswerte na yung mga mayors natin, kaya nagkaroon pa ng EO para maka-purchase ng local government. Because we need to remember, naka-EUA lang lahat ng bakuna. Even they want to, Secretary Galvez wants to sell this in public, hindi ho talaga pwede, Kailangan may FDA siya. It's only the government. That's why the government agreement para maprotektahan din yung mga private sector na gusto bumili. So by June, July, let's say dumating yung ating sa mga NCR mayors. Karamihan mga mayors natin, 50% or 50% natin binili for their constituents. So just imagine dadating yung sa mga LGUs, dumadating yung sa national government. So we can finish this. Kaya lang we should
yung vaccination of mayors, kasi I hope I read it right. May request yata yung League of Municipalities or Mayors na nagsabing frontliners kami. Dapat kasama kami sa mga unang mababakunahan.
I think they're sa category A4 na isama na po ating local government, mayors, governors, and barangay captains. Kasi sila po talaga nakaharap And another thing, this is one way of boosting the confidence of the people. If you see your leaders, yung kumbaga mayor ka, ama ka ng lungsod, anak mo yung mga constituents mo, of course, you need to show them this is safe and effective. I think it's one way also boosting the confidence of the people dito po sa ating vaccine.
Okay, well, I'll leave it at that, GM Jojo, and at least naliwanagan natin yung mga ilang bagay. I do hope that we can continue to stay in touch. Kung may new developments, pakisabihan lang kami kasi medyo marami pa rin hindi naliliwanagan. Medyo nakalimutan na yung
Na-relax.
under.
Hindi naman po kalimutan, no? Medyo na-relax. No? Na-relax.
Mm.
Kasi nga, everyday lalabas sila, hindi sila nahawa, hanggang masanay, nakakalimot. So dito po pinapaalala lang natin kung ano yung ating ginagawa. No? Wala naman po masyadong nabago. Napagdaanan na natin to. No? Ang sabi ko, yung muscle memory ba, na nagawin natin kung ano yung tama. Ang nalilimutan natin yung muscle memory na kung ano yung mag-aangat mali. So we need to practice this again. We practice this for more than 1 year. So ito, konting tiis na lang po. No? Huwag na lang po natin ikalat pa. Protektahan natin lahat. Dahil sabi ko nga, kahit pag uwi mo sa bayan, ang delikado. Yung mga nasa bayan na mahal mo sa bayan.
Thank you very much, GM Jojo Garcia. Have a good day.
Thank you very much, Sir Cito. God bless po at ingat po lagi.
Okay, that's GM Jojo Garcia of the MMDA. And yun po, no, I think that is something for all of you people to consider, especially those in the NCR, National Capital Region, Bulacan, Cavite, Laguna, and Rizal. Naka-travel bubble po kayo. And wala pong nagbago. There will be stricter implementation of health protocols. There will be checkpoints, etc. We need for this to work. This has to work, or else the next step will be from GCQ, you go to MECQ. You go back to MECQ, if not ECQ. We need to make this work. Let us pray to the good Lord that He will allow this to work. Have a great day. God bless all of you.